Hi, I'm Dr. Greg McDonald. I'm a veterinarian in Southern California. I have a hospital in Santa Barbara. I wanted to talk a little bit about dog care today. And one of the things that people often have as a problem with their dog is seizures. Seizures can be caused by lots of different reasons, and it's incredibly important for the owners to know the difference between a poisoning, where the dog is having a seizure because he ate something, or if the dog is an epileptic and having a seizure because of an abnormality inside of the brain, a little electrical discharge up in the brain. Epilepsy is probably the more common thing that people see, and once it's diagnosed, it can be treated by your veterinarian. Your veterinarian will pick a drug specifically for your dog, and unfortunately with seizures, if it's an epileptic dog, you don't just give them medication when they're having a seizure. You actually medicate them every day, sometimes 2 or 3 times a day, to prevent them from having a seizure. When you get to your veterinarian, if your dog is still having seizures, your veterinarian may want to be giving a product called Valium. It is an anti-seizure medication that your veterinarian can give intravenously that can control seizures. So we usually set up a determination if a dog should be on the medicine or not. Because the seizures don't hurt the animal in and of themselves, if your animal's having 1 or 2 seizures a month, usually we don't even medicate those because the medicine has more side effects than the seizures. If your animal's having more than 3 seizures a month, then we usually recommend starting medication. The medication does have some side effects, so we always try and choose the ones that are most effective with the least amount of side effects. And it's very important to understand that your veterinarian first has to diagnose this. Epilepsy is what we call a rule-out diagnosis. It simply means that we look at everything else, and if all that is fine and the dog is still having seizures, the dog is an epileptic. And then we're going to try and fix the dog's seizures by medication. Once your veterinarian starts the medication and you see positive results, he's going to want to do some blood tests in order to check and be sure that they're adequate levels and also not too high a level. So maybe a month after your dog has been on the medication, your veterinarian is going to want to do a blood level to be sure that the medication is working properly.